Welcome to Endodontics Part 3. The slide presentation is geared toward the dental assisting student. In this slide presentation, we're going to look at unresolved endodontic conditions, sterilization for endodontic instruments, and the scope of practice and supervision for the dental auxiliary. Unresolved endo conditions would be conditions that do not heal or resolve after endo treatment. Indications could be continued swelling and edema, pain, continued evidence of abscess on a radiographic image, or purulence. The etiology for these conditions could be that there is still infection, dilacerated roots, or root resorption. Thank you to the internet and other sources, but one of the treatments could be an incision and drain for either inflammation, lesions, abscesses, swelling, and so an endodontic treated tooth may respond to incision and drain. Also, for an incision and drain, if a patient comes into the office, and I'm going to kind of sneak this in here, before endodontic treatment, there may be some swelling, and so this could also be a palliative treatment. So, excuse me for sneaking it in, where also antibiotics might be warranted for this infection. But our focus right now in this slide presentation is for unresolved endo treatment. What may also be treatment for unresolved endodontic treatment are 3 procedures: an apicoectomy, a hemisection, or a root amputation. And in these radiographic images, we see that there's still an abscess in the radiograph, but I'm also going to use this radiograph as an image after an apicoectomy. There are lots of really great clinical videos online on the internet, and I recommend that you watch some of these to see the actual procedure. But in an apicoectomy, let's review terminology. Apico is referring to the root tip, and ectomy is removal of, and so a flap is placed at the site of the teeth, and then a handpiece is used to actually remove the apex of the tooth. And so because that is usually where the source of the abscess is and the infection. And by doing that, the endodontist may place a composite type retrofill to seal off this apex, and then the bone can begin to heal from removing that infection. Now, sometimes these procedures may be warranted if there is a dilacerated root, maybe a real curve to the root, and so that may be needed in order to complete the root canal. And so if this tooth had a real curvy root to it, maybe there was an inability to obturate to the apex, and so the tooth remained infected. So the apicoectomy is where the apex of the tooth is removed surgically, and a retro filling, usually a composite type filling, is placed at the apex to seal it. And this is a surgical procedure. Another procedure for a multi-rooted tooth would be a hemisection. So let's say that this is definitely the mandibular first molar, and maybe the distal root was just not being healing itself from the abscess, from the alveolar process. The endodontic treatment was not successful. So a doctor may decide to actually section the tooth in half and the patient would then have a smaller version. Sometimes a bridge will then be placed in this area, or perhaps an implant could now be placed in this area to restore it. A root amputation is somewhat similar to a hemisection in that it's a multi-rooted tooth and the root is removed, but the crown is left remaining. So you can see it's kind of holds the normal space, where in the hemisection, the space is certainly opened up and there needs to be some treatment here. Otherwise, usually this tooth here, let's say this is tooth number 30, or excuse me, 18, could start to tip. So in a root amputation, they simply remove the tip or remove the root, and you can see where I don't have a before radiograph, but you can see that the alveolar process is healed here, where probably there was once an abscess. So for unresolved root canal therapy, we would have either perhaps an incise and drain would help, apicoectomy, hemisection, or root amputation. Now let's look at the sterilization procedures. All infection control and sterilization procedures really should be standard in a dental office. I'm a real stickler about this. And there are, certain instruments, though, that must be handled in particular protocols or particular ways. So I want to talk in particular about the intracanal instruments, which are actually single-use instruments. They are meant to be disposable. That doesn't always happen in offices, dental offices, even in endodontic practices. But if you are in an office, dental assistants, that they're going to reuse the intracanal instruments, they should have limit use. Like I've known some offices that use them 3 times and they're marked, so that 3rd time they're thrown out. But you always should inspect them. If you're going to reuse the instruments, sterilize them and reuse them, they should be inspected before sterilization and before use as a double check. However, reusing intracanal instruments is not recommended. They are meant to be disposed of. Other endo instruments, we certainly will place them in the ultrasonic cleaner to remove debris. They should be dried, packaged, and sterilized, and they should be kept in their sterile packs until used. Anyone know what this is? If you're a dental assisting student, and because it's 2018, you may not know what this is. If you just happen to be looking at my slide presentation, this is a very old-fashioned, actually obsolete, what was called chairside sterilization, and it's a hot bead sterilizer. So this little machine gets to about 450 degrees Fahrenheit. It had little glass beads, and you would actually place the intracanal instruments at chairside, take them out, wipe it off with a 2x2, and then it would be sterile to go right into the canal. The problem with this little handy-dandy chairside sterilizer was that people were not wiping off the end of the intracanal instrument, and glass beads were left on the file or the reamer, and those were also left in the canal of the patient's tooth. Yikes! So these should not be being used for chairside. Like I said, it's very old-fashioned and not really effective as a sterilization method. The scope of practice and supervision for auxiliaries. If you are watching this and are not in California, please check with your state as to what is the scope of practice and supervision for your auxiliaries. If you're my student, Please review the scope of practice for endodontic procedures, some hints, dental dam, who can expose a radiographic image, who can dry canals, who can fit gutta percha in the canal for obturation, who can fit the gutta percha. Under what supervision may these procedures be performed by the auxiliary? I thank you very much for listening. This concludes Endo Part 3, and it concludes for my students the topics for the Dental Specialties 2 course. That means it's close to the end of the semester. Congratulations. Thank you.